Yellow fever, a devastating illness that has plagued humanity for centuries. Transmitted through mosquito bites, it can cause severe symptoms and even death. Vaccination efforts have reduced its threat, but it remains a concern in tropical regions. The good news is that yellow fever is preventable with a safe and effective vaccine. Understanding prevention measures is crucial for protecting ourselves and our communities. Yellow fever is primarily spread through the bite of infected mosquitoes, particularly the Aedes aegypti mosquito. This mosquito species is a notorious vector for several other diseases, including dengue fever, Zika virus, and chikungunya. These mosquitoes thrive in tropical and subtropical regions, breeding in stagnant water sources like discarded tires, flower pots, and open containers. When an infected mosquito bites a human, the yellow fever virus enters the bloodstream and begins to replicate. The virus then travels to various organs, including the liver, kidneys, and heart, where it can cause significant damage. While mosquito bites are the primary mode of transmission, there have been rare cases of yellow fever being spread through direct contact with infected blood or bodily fluids. It's important to note that yellow fever cannot be transmitted directly from person to person. This means that caring for someone with yellow fever does not pose a risk of infection, as long as proper hygiene and infection control measures are followed. Understanding the transmission cycle of yellow fever is crucial for implementing effective control strategies, such as mosquito control programs and vaccination campaigns. The symptoms of yellow fever can vary widely in severity, with some people experiencing only mild illness, while others develop life-threatening complications. The incubation period, which is the time between being infected and the onset of symptoms, typically ranges from 3 to 6 days, but it can be as long as 14 days. The initial phase of yellow fever often presents with flu-like symptoms that can easily be mistaken for other common illnesses. These symptoms include sudden onset of fever, headache, muscle aches, especially back pain, chills, loss of appetite, nausea, and vomiting. This initial phase usually lasts for 3 to 4 days. Some people may recover completely after this phase, while others will progress to a more severe, toxic phase of the disease. It's important to seek medical attention immediately if you develop these symptoms after traveling to an area where yellow fever is present. In some individuals, the initial phase of yellow fever is followed by a brief period of remission, where symptoms seem to improve. However, this is often a deceptive calm before the storm, as the virus continues to wreak havoc within the body. The toxic phase of yellow fever typically begins 2 to 5 days after the initial symptoms appear. This phase is characterized by more severe symptoms, including high fever, jaundice, yellowing of the skin and eyes, abdominal pain and tenderness, bleeding from the nose, gums, or gastrointestinal tract, vomiting blood, decreased urine output, seizures, and coma. The toxic phase of yellow fever is a medical emergency that requires immediate hospitalization. The virus can cause severe damage to the liver, kidneys, and other organs, leading to multiple organ failure and death. The chances of survival are significantly reduced once the toxic phase develops. Section 5. Unmasking the enemy. Diagnosis of yellow fever. Diagnosing yellow fever can be challenging, especially in its early stages when symptoms mimic other common illnesses. Doctors rely on a combination of clinical evaluation, travel history, and laboratory testing to confirm a diagnosis. During a clinical evaluation, the doctor will ask about recent travel to areas where yellow fever is endemic, as well as any potential exposure to mosquitoes. They will also perform a physical exam to assess for symptoms such as fever, jaundice, and abdominal tenderness. Laboratory tests play a crucial role in confirming a yellow fever diagnosis. Blood tests can detect the presence of the virus or antibodies produced by the body in response to the infection. Other laboratory tests may be conducted to assess liver and kidney function, as these organs are often affected by the virus. Early diagnosis is essential for improving the chances of survival and preventing further spread of the disease. Section 6. Holding the line. Treatment and supportive care. Unfortunately, there is no specific antiviral treatment for yellow fever. Treatment primarily focuses on managing symptoms and providing supportive care to help the body fight off the infection. This may include hospitalization to closely monitor vital signs and provide intensive care if needed, intravenous fluids to prevent dehydration, medications to reduce fever and pain, oxygen therapy to assist with breathing, and dialysis if kidney function is impaired. While there is no cure for yellow fever, early and aggressive supportive care can significantly improve the odds of survival. Researchers are constantly working to develop antiviral drugs and other therapies for yellow fever, but until then, prevention remains the most effective weapon against this deadly disease. Section 7. The shield of prevention: vaccination, your best defense. Prevention is key when it comes to protecting yourself and your community from yellow fever. Vaccination is the most effective way to prevent yellow fever infection. The yellow fever vaccine is a live attenuated vaccine, which means it contains a weakened form of the virus that triggers an immune response without causing the disease. The vaccine is safe and highly effective, providing lifelong immunity for most people after a single dose. The World Health Organization recommends yellow fever vaccination for all travelers aged 9 months and older who are visiting or living in areas where yellow fever is a risk. These areas include most countries in sub-Saharan Africa, tropical regions of South America, and some parts of Central America and the Caribbean. Vaccination is usually administered at least 10 days before travel to allow the body enough time to build immunity. In addition to travelers, the World Health Organization also recommends routine yellow fever vaccination for people living in endemic areas to prevent outbreaks. Section 8. Winning the war against mosquitoes. While vaccination plays a crucial role in preventing yellow fever, mosquito control efforts are equally important in breaking the chain of transmission. Mosquito control measures aim to reduce the mosquito population and minimize human-mosquito contact. These measures include eliminating mosquito breeding sites. This involves removing stagnant water sources around homes and communities, such as discarded tires, flower pots, and open containers. Using mosquito repellents. Applying insect repellents containing DEET, picaridin, or oil of lemon eucalyptus to exposed skin can help deter mosquitoes. Wearing protective clothing. When outdoors in mosquito-prone areas, wearing long-sleeve shirts, long pants, and socks can reduce the risk of mosquito bites. Sleeping under insecticide-treated mosquito nets. Mosquito nets, especially those treated with insecticides, provide an extra layer of protection against mosquito bites while sleeping. By implementing these mosquito control measures, communities can significantly reduce the risk of yellow fever transmission and protect their populations. Section 9. The global impact: yellow fever in a connected world. In our increasingly interconnected world, diseases like yellow fever can quickly transcend borders and pose a global health threat. Outbreaks in one part of the world can have far-reaching consequences affecting travel, trade, and public health systems. The 2016 yellow fever outbreak in Angola, which spread to other countries in Africa and even to China, highlighted the vulnerability of the global community to this preventable disease. The outbreak underscored the importance of strengthening surveillance systems to detect and respond to outbreaks quickly, maintaining high vaccination coverage in endemic areas, ensuring adequate vaccine stockpiles for emergency response, and raising awareness about yellow fever and its prevention among travelers and healthcare providers. International cooperation and collaboration are essential for controlling yellow fever and preventing future outbreaks. By working together, we can create a world where this deadly disease is no longer a threat. Section 10. A call to action: protecting yourself and others. Yellow fever is a serious disease, but it is a preventable one. We all have a role to play in protecting ourselves, our families, and our communities from this threat. If you are traveling to an area where yellow fever is a risk, make sure you are vaccinated at least 10 days before your trip. Consult with your healthcare provider to determine your individual risk and discuss any necessary precautions. In addition to vaccination, take steps to prevent mosquito bites by using insect repellent, wearing protective clothing, and eliminating mosquito breeding sites around your home. By taking these simple yet effective measures, we can protect ourselves and prevent the spread of this deadly disease. Section 11. Conclusion: yellow fever, a preventable threat. Yellow fever, a viral hemorrhagic fever with potentially devastating consequences, continues to pose a significant public health challenge in certain regions of the world. While medical advancements have led to improvements in supportive care, there is still no cure for this disease. Therefore, prevention remains our most potent weapon against yellow fever. Vaccination, coupled with robust mosquito control efforts, forms the cornerstone of effective yellow fever prevention. By understanding the disease, its transmission, and the available preventive measures, we can empower ourselves and our communities to stay safe and healthy. Let us all do our part to make yellow fever a disease of the past.